happy by caring for them in ways that no one else has before. The nurses barely get enough time to finish. My name is Claire Rackham, and I did my project at Children's National Hospital in DC on a specific unit in that hospital. It's on the 6th floor in the East North Wing, and it's called the Intestinal Rehab Unit. And this unit used to be on the 7th floor. On the 7th floor, there's 50 beds, so it's a huge unit. But they decided to move the intestinal rehab program down to the 6th floor. It's smaller, it's about 12 beds. And the reason they did that was because these kids that are in the intestinal rehab program just have a lot of specific care and need a lot of attention that they couldn't receive on that really big unit. So some of the illnesses that you'll see in this floor, most of them have short bowel syndrome, and what that is when an infant has to get most of their intestines surgically removed, because for one reason or another they may have an infection of the intestines, or their blockage of blood flow, so the intestines kind of die off, something like that. And that causes a lot of problems because, if you don't have intestines, then you can't absorb nutrients and you can't grow, so there's a lot of things going on for them. So a little bit about the demographics. Interestingly, the majority of the intestinal rehab patients are minorities of lower socioeconomic levels. There's kind of a correlation between kids that develop short bowel syndrome and a lower socioeconomic level, and there's a cycle that goes on. So women who are pregnant and are financially struggling often do not have the means to receive proper prenatal care. Many do not have cars and are unable to get to and from prenatal doctor's appointments. They may not be financially stable enough to buy nutritious foods, vitamins, and other nutrients that are necessary for proper fetal development. As a result of this lack of nutrients, the health of these infants is compromised and they are more prone to infection of the intestines. Consequently, they are more likely to have to get some of their digestive tract surgically removed, and they then become burdened with short bowel syndrome for the rest of their lives. And because these mothers are financially struggling, they often have a hard time getting to and from the hospital, and they also have other kids at home, so they really can't visit their sick child. And so most of these kids on this unit are kind of parentless for the whole time they're there, and sometimes they're there for months on end, and they're just by themselves, so that's kind of sad. So my first impression of this unit was not very welcoming. It was 6:45 in the morning during my first visit, and the entire unit was dim and quiet. I also had a really hard time finding the front desk, so that was kind of weird because usually you see it right after you get off the elevator, or, in a really convenient place, but it was kind of hard to find. So to give you a picture of the unit, it's made up of 2 concentric squares, and on the outside square are the 12 hospital rooms, and most of the time they're all occupied, so it makes for a full capacity unit. And on the inside square are the other things like the nurse's station, the medication room, the supply rooms, the break room, the nurse manager's office, and the meeting room for the doctors. So one of the things that really struck me on this unit were the cribs. They're really jail-like looking. They're a horrible off-white color, thick metal bars, and a plastic overhead hood, and they make horrible metal sounds when you open and close them. And so they're really not very comforting, I don't think. But the manager who I talked to, Dee Dee, is the one I interviewed, she told me that there's a lot of toddler safety issues, so that's why they need very heavy-duty cribs so that, they don't have any falls or any safety issues. And all throughout the hallways is decorated in lily pad theme, so there's lily pads everywhere. The walls are white but decorated with pictures of animals and flowers. And in the rooms, the lily pad theme continues, and the walls are painted different colors in each room. And there's kind of, in each room, even though there's different layout of furniture, there's kind of a standard for each room. There's either a regular hospital bed or a crib, and there's a bathroom with a shower, a storage closet, a table with 2 chairs, a whiteboard for doctors and nurses' messages, and a counter near the door where medical supplies is kept. So some of my preconceptions about this unit are that the nurses are not very attentive. They were kind of so busy and constantly on the move. They were in and out of each patient's room, appearing to always be one step behind and trying to catch up. And to me, it didn't seem like they were very patient-oriented and were more task-oriented and not focused on taking the time to comfort the patients. Another thing that I noticed was there was not a doctor in sight. And as far as the patients, before I got to know them, I assumed that they would not be significantly different from any other kids in the hospital. And I assumed that their parents would be by their side the whole time, that they would be the ones advocating for them. So I'll tell you a story about one of the frequent flyer patients who's always in the hospital. And for this purpose of this paper, her name is Anna, but that's not her real name. She's a 7-year-old, and she has short bowel syndrome. And she goes home for maybe a week at a time and then comes back and stays in the hospital for weeks to months. And she's well known by everyone because she kind of gets into a lot of trouble. And the most recent incident happened during the night shift, and she had gone to bed and had been asleep for a few hours. And in the middle of the night, she got out of bed, climbed on top of a chair, and reached a bottle of medicine and just drank the whole thing. And so that was a huge issue, that she got herself into trouble. And she said that she didn't do anything, but we all know that she's kind of a chronic liar, and so no one really believed that. But a few days after that incident, I just wanted to ask her a few questions to kind of get, some interviews from some patients, even though she's only 7, but she's very, very smart and on a daily basis surprises me with how intelligent she is. So I asked her if her mom does a lot to care for her. And she said to me, no, she doesn't care enough for me. And she said, but it's okay. She has a new baby, so I understand. She said, my mom says the baby is more important, so I know that it's okay if she can't take care of me a lot. So that kind of really struck me and just made me realize how these kids really do not have a good home life. So some changes in my preconceptions. After working on this unit for a month, I now have a different view of this unit. I've formed personal relationships with the nurses, and the patients now know me by my first name. In the beginning, I felt that the nurses seemed cold and did not do the little things to comfort the patients. But I now realize that there's just so many patients that it's hard for them to have the time to comfort them because they have other things that are really necessary for their health. If the nurse has any free time in their schedule, then I do see them making a point to give attention to a child. And when there's no time for that, then they at least try to keep them occupied with other methods, like putting them in a playpen full of toys, or making sure there is always a movie playing. My preconceptions about the intestinal rehab kids changed dramatically after getting to know the unit better. I learned that these kids are in fact different than most of the children on other units. Their parents are actually not there most of the time, and they do not advocate for their children. They're not the kind of sick children who are constantly cared for by their parents, but they are unfortunately the kind of sick children who are abandoned by their parents. My preconceptions about the doctors on this unit have not changed since the beginning. They are as absent as I thought they were from the first day. I see the doctors maybe a few times a day, and they only go into the patients' rooms once a day, maybe. The doctors are in the meeting rooms most of the day discussing patients and then calling the nurses and telling them what needs to be done. Although the doctors are the ones making the major decisions, they would not be able to do so without the input of the nurses. The nurses on this floor are the ones that get to know the patients and can tell when something is wrong. They advocate for the patients and even suggest to the doctors a course of action, which is usually the right one. Most of the time, the parents of these patients don't provide them with necessities such as clothes or toothbrushes, and the nurses are often the ones who buy them those necessities and toys to play with. The nurses and staff of the intestinal rehab unit have developed personal relationships with these children and go above and beyond their call of duty. I have a newfound respect for the nurses of 6 East North because they truly sacrifice themselves and put all of their energy into maintaining their patients' health. Overall, in conclusion, through my field work and my experience on this unit, I've been able to grasp the culture of 6 East North. The staff make the children so happy by caring for them in ways that no one else has before. The nurses barely get enough time to finish their lunches because they spend every minute of their day healing their patients. Every person on this unit works to give these children a better life, even if it seems like it may be impossible to do so. The small gifts of smiles and laughter from joyful children are what fuel the nurses to keep pushing through their stressful day. This small unit is filled with sick, underprivileged, attention-seeking children, but its culture is not one of sadness and sorrow. It is a culture of hope and perseverance. This experience has given me the gift of appreciation for my health and the knowledge that amongst the many communities in the world that are built upon selfish goals, there are those, like the Intestinal Rehab Unit, whose sole purpose is to lift up children in need. Thank you.